Welcome back to the Deep Dive. Today, we're shining a light on a health check that is surprisingly powerful, but often misunderstood.
The ferritin blood test.
Exactly. It's a simple test, very accessible across the UK, and it tells this crucial kind of hidden story about your health. We've been digging into insights from experts, especially the information published by Blood Test UK.
That's absolutely right. And our mission today is to give you a shortcut to being really well informed about your iron. This deep dive is about understanding not just the test, but the huge benefits of monitoring your iron storage.
Your storage, right. Not just what's floating around.
Precisely. It's a foundational step for managing your long-term wellness.
Okay, so let's unpack this in the simplest way possible. Ferritin is essentially your body's long-term storage locker for iron.
That's a great way to put it.
Iron is vital for energy, right? But this test doesn't check the iron you just had in your steak. It checks the reserves you've got tucked away for later.
And what's so fascinating here is that checking those reserves is the fastest way to find out if you have an iron deficiency, which, is a huge cause of feeling exhausted or weak.
That brain fog feeling.
Yeah, exactly. Or, on the flip side, if you have too much iron stored up, experts at places like Blood Test UK confirm this is vital for catching issues like anemia. It lets clinics in local areas, from big cities to smaller towns like Elgin, make quick, smart decisions about your care.
And that really gets to the core benefit, doesn't it? Early, preventive checking.
Yes.
It means you can catch and fix these small problems before they, balloon into something much more serious.
Precisely. And the procedure itself is incredibly straightforward.
Just a blood test.
Just a quick, simple blood draw. It's common in basically any UK clinic.
Now, if you are going for this test, you do have a small part to play to make sure the results are accurate.
Right.
We learned from Blood Test UK that to get a reliable reading, you usually need to avoid taking iron supplements for at least 24 hours, and you might need to fast. So no food for about 8 to 12 hours before the test.
Yeah, that's key. They want to measure the steady reserves, not the iron from what you just ate for breakfast.
Makes sense.
And if we sort of connect this to the bigger picture, UK studies show that regular ferritin monitoring leads to much better outcomes. For people dealing with chronic iron issues, it means fewer urgent hospital visits.
So this proactive approach isn't just better for your health.
No, it's also really cost-effective. Checking early saves a lot of resources down the line.
Okay, let's talk numbers, because this is where the picture gets a little more, complicated. The normal level is different for men and women, right?
It is. For men, the range is usually something like 30 to 300 micrograms per liter. For women, it's lower, often 15 to 200.
And why the big difference there?
Well, the lower range for women is often due to things like monthly blood loss. But here's the real deep dive insight, and it's a tricky one. Ferritin levels can be deceptive. Your number might look high, which you'd think means iron overload, but it can actually be elevated just because of inflammation.
So like if you have a recent infection or some other chronic condition.
Exactly. The body kind of raises the ferritin number as a general distress signal, even if your iron storage locker isn't actually full.
So it's like a false flag. You need a healthcare provider to look at the whole picture.
You absolutely do. They have to factor in the full clinical context, especially when they're looking at data from a provider like Blood Test UK.
So what does this all mean for you listening? Checking your iron storage is a powerful, simple step in managing your health, and it's easily accessed all across the UK.
But just remember that nuanced factor. Because things like inflammation can confuse the results, a single ferritin test is often just the beginning of the conversation.
Right, not the final word.
Not at all. That's why health providers use robust protocols, combining ferritin with other tests to make sure they get the diagnosis absolutely right.
So thinking about all this key information, the simplicity, the preventive power, and that tricky inflammation piece, here's a thought to leave you with. Could regular, simple monitoring of your iron storage levels be the single most effective yet overlooked way for you to address unexplained fatigue and boost your overall health this year?